I'm having trouble getting over seeing that poor young lady descend into the stool. But maybe you could show it to me again just to wrap up here, because it was for me the moment of the day.
I only exist to make you happy, Drew. Here it comes.
Oh, no, that can't be.
Hi, I'm Dr. Drew, and this is Dr. Drew After Dark. Please be advised that Dr. Drew After Dark may contain sexually oriented content and be unsuitable for young children.
Watch Gang is the world's largest watch club. It's revolutionizing the way we buy and discover watches. They have a free membership, and you get access to 3 subscription levels, the Wheel of Watches, and exclusive member-only deals at Watch Gang Store. Watch Gang allows casual watch enthusiasts and watch obsessed alike to build your watch collection, and you get up to 70% off from brand names and receive a watch on your schedule. Watch Gang members get a chance to win a Rolex every Friday, Tag Heuer every Tuesday, and Seiko every Saturday. It is crazy. Look, Nadav, I'm wearing my Watch Gang. They made me a watch wearer. Not only that, when my watches arrived, my sons depended upon them and went crazy about the style. They ask you what kind of watches you like, and they give you exactly what you need in terms of the band style and the size and everything about it. They know what they're doing. And I'm going to have to get in that lottery to win the Rolex and the Tag Heuer. This is ridiculous. This is by far the best deal going. Go to watchgang.com and get started now. Again, it's WATCHGANG, watchgang.com. Get started. Use code DREW for 20% off your first purchase. That's watchgang.com, code DREW for 20% off. Hey, everyone. Welcome to Dr. Drew After Dark. Keep keeping those emails coming at drdrewafterdark@gmail.com. And, of course, the phone number for the voice messages, 818-253-1693. And speaking of the emails and the voice messages, today is a very special show where I am just going to answer your questions. That's what we're going to do. We're going to do, well, and the control room's questions as well. Those guys may get into the act. Who knows? So we do appreciate you sending those messages in so I can do this. And we'll look at a couple of cool guy videos while we're at it as well. So let us open up with some voice messages, and I'll get to some emails, but let's get right into it. Got a voice message for me?
Hey, Mommy. I'm a 53-year-old male with a hernia above the base of my schlong. When I J my D, my right clacker sucks up to where the hernia is, and it gets a little uncomfortable. I can deal with the pain, but I'm wondering if I'm aggravating the hernia by wanking. I'm also wondering if I gave myself the hernia from bashing the bishop a little too much. Give it to me straight, Doc. Don't be stingy.
I won't be stingy, but again...
What a poet.
Yeah, I know. I prefer the poetry on the emails. I got to say, when people say the poetry, it doesn't sound quite so poetic. It sounds kind of weird. But you do not get hernias from jacking off, sir, to put it bluntly.
What if they jerk off real hard?
You do not get hernias. You don't get... Hernias are sort of genetic in the sense that, why don't we get a picture up of what a hernia is? Because people don't even know what that is. Look, inguinal hernia he's talking about. Hernia is any time, essentially, bowel breaks through the abdominal wall. It's a hernia. It doesn't have to be, you can have hernias in your diaphragm too. So, get something inside so I can show you the bowel coming. There, that one. See, it's bowel descending down through the inguinal canal. Did you know it was that, Nadav?
Of course I did. I'm a doctor now.
But I mean,
Drew.
Does that surprise you to see that's what it is?
No, this is just a textbook inguinal hernia.
Yeah, but I mean, does it surprise you to see what an inguinal hernia is? Is that something you would have known?
Yeah.
Okay. So that, and you
come on, doctor. This is year 1 doctor stuff.
But you have to have a weak abdominal layer for it to come through, and you can weaken that by running or lifting very heavy weights, things like that. It can kind of contribute to it, but it's one of those things that sort of has a genetic component to it. It has nothing to do with sexuality. It's just in the region of your Peter.
So activities that require a lot of pushing is something that could do that?
Really pushing. Because again, when you're pushing, you're increasing the pressure, and then that makes the weak canal to more likely to extrude through, the bowel to extrude through that weakened canal.
What if that's how he whites? What if he pushes real hard when he whites?
No. Like Olympic, weightlifter kind of stress. You're not doing that when you're wiping. You understand me?
Immense kinds of... Actually, okay. Here's something interesting.
God, where are we going with this?
All right, this took me into... So, I had diverticulitis when I was a lot younger.
That's fun.
And I had 10 centimeters of my colon removed.
Right.
And so one of my first questions was like, can I jack off when I get home. And because like I'd been in the hospital.
Did you ask the doctor that?
I was like 2 or 3 weeks in the hospital.
Did you ask the doctor that?
Yeah.
Oh God, that is he tells that story to his peers. so
he said, wait a little bit, it's because they just like connected some stuff. He's like, a lot of stuff in you is like just freshly reconnected.
That is your abdominal, right? I mean, that's healing of wounds. It's a different thing. I get what you're associating.
And I definitely whited way too early when I got home because I felt a really weird. I felt exactly where my connection was.
Yeah, I mean, you don't even want to doing a sit up. You don't, right? You don't want to be even sitting up from a lying position without doing that very cautiously. That's when you have a big surgical wound. That's different. It's very different. This something that has to heal. This is a weakened canal. So, yeah, and all his preoccupation with his whiting need not be anything to do with his hernia. Did he say he was 50? 50 something? Play me the beginning of the tape again, just the very beginning.
Hey, Mommy, I'm a 53-year-old male with a hernia.
53-year-old who sounds 17, dude. I'm more worried about that and the crazy poetry about you're 53. Poet. You're going on you're waxing poetic about masturbating at 53. And so attached to your masturbatory behaviors, you're concerned it's having an effect on a hernia. That's what I'm worried about, not the hernia. I'm just saying. Give me another voice message. My goodness.
Hey, Dr. Mommy and Mama Tina. My name is Charlotte. I'm 30 years old from California. Mm-hmm. My question is, I get this sensation in my hip, like a light version of when you hit your funny bone. It lasts about 30 seconds to a few minutes. It's not painful, but I don't enjoy it. I don't enjoy it at all. It happens at least once a week, sometimes a few times a week, and as long as I can remember it, it's just been happening. The best way to describe where the spot is on my hip is if you drew a line from my right nipple to my hip and about an inch to the right. So more my front hip than the side. It's not bruised. I don't run into things often. It happens more when I'm sitting or laying, but not exclusively. I have no idea what this could be. Thanks so much. High and tight.
Well, unfortunately, she's not very descriptive. It's something about a funny bone. I don't know what she's talking about, except that when you hit your elbow, sometimes you can hit the ulnar nerve that runs along there, and it can be sort of unpleasant, your whole arm, and it's sort of a tender spot. She didn't describe hitting anything. She described a funny feeling like that in her hip, and that is the hip right there in the front part, that inguinal area. That is, in fact, the hip. Makes me wonder if she had some congenital hip problem. It sounds more like a soft tissue issue, like some sort of tendonitis. That's I don't know. I would have to examine it. I have to know. She'd have to be able to describe it a lot better than that for me to be able to tell her something. Unfortunately, why do splinters hurt so bad? Here we go. I had tiny object between the few layers of my skin. Hurts worse than a bloody gash in the same place. Sidebar: paper cuts are in the same category. Why is this? It's a really interesting question. That's something that physiologists have thought about. Like, someone gets a major injury, a gunshot wound to their arm. It kind of burns. They barely feel it. But you get a tiny little, a cactus burn, some sort of burn in your finger, and it's terribly painful. Has something to do with the fact that, first of all, your hand has lots of innervation. So we're talking about the hands. And the different kinds of sensory receptors in the skin that detect pain, to detect injury. There are lots of them, and they're designed this way so they can really be discernible, so you can really localize where the pain is. And when it's something major, it doesn't have to be that discerning, right? You're just like, my hand is injured. I can see the whole thing is gone. And that it's more important to not feel the pain, so you can, from an evolutionary perspective, so you can get to help, get the bleeding to stop, that kind of thing. But it is an interesting question. So it really is a function of the innervation of the hand and the density of the pain fibers. We have these very strange little devices in our skin that convert essentially electrical energy into pain. All right, ganglion cyst inside my right wrist. That's super conscious of. I basically always wear sleeves to cover it. Ganglion cyst is just a little cyst that comes off the synovium of the wrist. Yeah. And I've got one right here. There it is. That's a classic ganglion cyst. No, you show me go back. The picture in the lower left-hand corner is a more classic. That's what it looks like. So you see how it's a lump in your hand or in your wrist, and people get very concerned about the appearance of that, so they try to cover it. Let's see.
Ooh, and actually, I remember like back in the day, they would say, they'd call it a Bible bump, right?
Correct.
Because you would have to take a Bible and smack it down.
And whack it. Take a big book and whack it, and it pops.
Yeah.
And it tends to come back.
Yeah, Dr. Nadav knows all of these things.
It's so good. Listen, after we had our mommy or doctor game last week, you're a doctor. We've established that. So it's the size of a golf ball, sticks out like a sore thumb. My birth giver has the same ailment. Does that mean her mom? Birth giver? But is a cyst made up of fluid? In my case, it's always been hardened. It's still got fluid in it, trust me. That makes it harder to have the procedure done because you have to be put under and have it cut out rather than having it drained. That's true. So it's a more dense cyst. I've had this done twice, and she's had her drained 5 or 6 times. It always comes back, right? I really don't want to ask for time off of work to have the procedure done again. I know it's going to come back again. She's saying she's had it completely removed because usually when you have it fully excised, that's the end of it. Do I need to accept this? Hang on again. It's harder to have the procedure done because you have to go under to have it cut out rather than having it drained. Then she says, I've had this done twice. I think she means drained. Have it done. Have it removed. If it's that troublesome to you, it's a bigger surgery than you might imagine because it communicates with your wrist. So the wrist actually gets opened up sometimes. But get it done. It really bothers you to get it done. All right. Boyfriend and I have been together for 6 years now. We have sex up to 2 to 3 times a day. Hello, chomos. This does vary sometimes depending on health issues or if I'm bleeding. I've suspected for a while that maybe he produces more testosterone than normal. Seems like it. He's also bipolar 2. He's medicated. I wonder if that has something to do with it. It can. That's a good point. It's always in the morning he wants it the most. It can be annoying because I just want to get out of bed and start my day. And I've noticed if I do not milk him, he becomes grumpy. Yes, we're that way, men. He swears to me this is not true. Is this something I can do? Any advice? Do you know why this man is always wanting his dick milked? And what do you think of him unknowingly being grumpy in the mornings if no dick touches? Keep feathering it. Love you. She doesn't give us her name. Many men, I would dare say most men are this way. That Christina and I have talked about this, how if you just give the proper attention for what that man's rhythm is sexually, their mood is better, particularly interpersonally. There's a crazy thing with men and sexuality, which is they've been contending with this since they were 13. It's a very, very, very intense thing that has been troubling him since he was 13. And he has now selected you to be the person that he spends his life with. And as part of that, contends with this on his behalf, helps him deal with this. And because it's very much, not only is it very rejecting when you sort of don't seem to understand that it's a really intense thing and our physiology is very tied up in it, and to sort of dismiss it is hurtful. And I don't mean they can't tolerate it. I mean, it's just sort of it's sort of minimizing how big a problem this is for your partner. A, and B, we're very touchy about it. It's very tied into our sense of worth and self-being. And if we feel rejected sexually, I mean, think about it yourself. Women get the same way. If you're rejected sexually, you feel not worthwhile and not lovable. But for men, love and attention is very much tied up into this physiology. And it's hard for them. But the key thing I think the women need to get under a particular long-term partner has to understand is that this is now something that you have to contend with him. It's unfortunate, but he has selected you to help him. And this particular partner is a guy with an engine that's running at a very high pitch. He probably does have high testosterone levels, and certainly his bipolar disorder does have something to do with this. Hypersexuality. He's bipolar 2, meaning he's never had a manic episode. I wonder if that's true. I also wonder if he's adequately medicated. So properly medicating his bipolar disorder with a mood stabilizer may help some of this. And secondly, you're going to have to reach a compromise with him where some days he just lets you get out of bed and you understand he's going to be grumpy, and he understands that that's a common side effect for men, that they don't realize how much it affects them. As men, we don't realize how much it affects us in terms of irritability and things like that. It just does. I have an addiction to pornography. Please don't put that on a reel, Nadav. Probably
Too
sex
late. We're
by
already
extension, right? I cannot go for more than a day or two without watching, no matter how much I try. I have zero willpower. I don't know how to stop. It doesn't help that I have an insanely high sex drive. I'm 24. I've been watching porn compulsively for 8 or 9 years. So let's just say 10 years since he was 14. Interferes with my performance in bed when I'm with someone new, though I work around it. He doesn't tell us exactly how, which is kind of interesting. My viewing habits have gotten more extreme, too, to things I probably would never enjoy actually doing. What advice do you have to combat this? Who should I see? I have tons of money for expensive therapy. Don't have tons of money for expensive therapy. Elliot, this is a really big problem. We're seeing more and more men actually have even erectile dysfunction because of excessive porn use, porn participation. And it is primarily the pornography that you're describing here that's the troubling habit that you want to stop. You haven't said you're not frequenting prostitutes, you're not cheating, you're not having problem in your relationships because of sexuality. You're having trouble functioning in a relationship because of pornography, which is a really common thing these days. So there are people that specialize in treating this. It usually takes a bit of work. It, of course, requires you being willing to go cold jerky for a while, where you do not masturbate for really a period of time. What happens is therapists that work in this area do something called a circle plan, which is where you put things in the center of the circle you just will not do. You have things in the outer circle that you can still do but are kind of slippery, and you have healthy things you try to participate in the outer circle. Of course, SLA is always out there. I actually did a stream on this a couple of weeks ago with Bob Forrest. We had a woman that does a lot of treatment in the sex addiction field. I can't remember her name, but we do talk about a lot of the basics of sex addiction. There is a good website called centerforhealthysex.com, centerforhealthysex.com. Dr. Katahakis is there, and she does a great job of running that site. That's sort of where I would refer you for something like this. But it's kind of complicated to get over it. It's a little more of a problem than you might imagine, because it is a very intense biology, much like crack or other very powerful drives.
But Drew, if he just takes like a couple weeks off, doesn't that already reset? Like, is it that complicated to just stop watching?
He can try it. He can try it. I mean, look, what makes something addiction is you try and you can't, right? So what I'm getting from his note is that he has tried and he can't stop, right? If you can stop, go ahead and stop, right? It's that simple. But if you can't stop, that's when you need help.
What if he duct tape oven mitts onto his hands?
It won't do anything. Trust me, he'll find a way through it. Now you have to sort of clean your computer up and stay away from your phone and all kinds of things like that, or else you will magically go back to it. It's much like being around crack. You have a crack pipe in your computer. It's like your computer and your phone is a crack pipe. Now, if you can stop I would try stopping for more like 4 weeks, frankly, to try to reset things and then see if you can control it after that. If you can make it the 4 weeks and if you can control it after that, so fine, then that's good. But I suspect that's going to be difficult. Listen, I'm a healthy male in my 30s. I'm prescribed Adderall for ADHD, 20 milligrams generic, IR 3 times a day. 8 years, don't take other medications. I have an issue where I spontaneously cream my pants when I take Adderall. What? It doesn't happen every time. I notice when it does, it usually happens at the end of making yellow. Oh, so he's not actually having an orgasm. He's having just a flow out of some semen. If I'm thinking sexual thoughts or casually looking at porn, I also notice it happens significantly more if I've had anything alcoholic to drink. When it happened, it's hard to stop. I feel it moving through my urethra and it comes out clear or cloudy. Or sometimes retrograde. Oh my goodness. I know for a fact it's not an STD. So, okay. Monogamous relationship. Is this normal? Okay. What you're describing is just some emissions of semen, right? You're not having spontaneous orgasms. You're having some leakage. And that is because the Adderall is loosening there's some valves down there. Like you notice you never pee and white at the same time, right? Because there's a valve that shuts off the pee when it's time to white, lets the white go down. That valve is a little loose right now, let's say. And because of the medication, and for whatever reason, this stuff leaking out of the seminal vesicles and kind of getting through. That's the medication. Tell your doctor. There are things you can do to sort of support that, but the medicines aren't that good. It may mean reducing the dose of the medication, perhaps, or maybe living with this. It's possible. Next up, our friends at Audible. They are the leading provider of spoken word entertainment and audiobooks, ranging from bestsellers and new releases to celebrity memoirs, languages, business motivation, and now podcast as well. I have friends, literally, when I recommend a book to them, their first question to me is it on Audible? Can I listen to it? And I don't blame them. I was talking to a friend just last night who was saying he is literally reads about 8 times more books now because of Audible. And look, that you can dual task. You listen when you're in the car, when you're working out. And they've just launched their newest plan, the Audible Plus. And with Audible Plus, you get full access to the Plus catalog which is filled with thousands of select originals, audiobooks, and podcasts, including ad-free versions of popular shows as well as exclusive series. Audible Plus connects you to tons of content that entertains, inspires, informs. Easy to find just the right listen, whether it's comedy, romances, whatever you like. You can even get a workout in, as I said, where you're driving somewhere, going to work, whatever it is. And with everything you want to listen to all in one app, Audible Plus can become the playlist for your life. And listen, one of the things that we always see in people who are successful, they read books. That's always the case. So if you want to be more successful, you can use Audible as your means to reading the book. If you don't have time, I guarantee you do have time. You can always send in the audio material while you're doing other things. So visit audible.com/afterdark or text After Dark, just the word After Dark, together, one word, to 500-500, and you can start your free 30-day trial immediately. Again, that is After Dark to 500-500. Do it now. Can I explain how asparagus pee works? I've heard some people can smell it and some can't. No. Some people create the smell and some don't. Can you explain this mysterious aromatic phenomenon? Piss on me, beat me. Look it up for me. Asparagus pee. I forget what the name of there's a compound that's converted by the liver in about, I think, 60% of people. All right, here it is. The asparagusic acid produces many sulfurous byproducts, and your pee a rotten-like smell. Doesn't say exactly what it is. Why does it? Let's click on why does asparagus make your pee smell? There we go. Not everyone will have the asparagus pee smell. That is correct. Up, it's the asparagusic acid in asparagus that gets the sulfurous byproducts. Not everyone produces it. Doesn't give us the percentages. Okay, it doesn't say what the specific thing is, although it is a byproduct of the asparagusic acid. And I think it's about 60%. Ask this: what percent of people make pee smell from asparagus? How about that? What percentage people have pee smell? Have stinky pee? Yes, that's a great way to ask the question, Nadav. Well done. After asparagus, 40%.
See, I got the answer.
You got the answer. So almost everyone produces the scent to some degree. It's not everyone knows to pick it up. In fact, in some study my colleagues conducted in 2017, only 40% of those surveyed reported detecting the odor in their urine. So there you go. It is a liver enzyme that can...
I do have a question about, because that is the most interesting thing to me about asparagus pee. My pee does smell like sewage when I eat asparagus.
Yes.
And I'm wondering, it does come as early as 15 minutes. Like, it seems like nothing goes through the body as quickly as asparagus.
That's an interesting point. Acid. Yeah, I like that's interesting because it usually... things spend, maybe 90 minutes in the stomach getting sort of broken down before they even get to the small bowel. So I'm guessing, so it must be that in the liquid in the stomach, in the acid, some of that asparagus compound, the chemical, must dilute and trickle into the small bowel and get quickly absorbed. That's got to be the process. And then it's immediately converted by the liver, and then then all of your pee is contaminated at that point. And what's interesting is there's not a sort of dose-response relationship with it. In other words, the more you absorb of this product, the more your liver converts it, the more your pee smells. It's like maximal effect in 15 minutes, which is interesting.
So now I have another follow-up question that's kind of in the same lane as this.
All right.
So asparagusic acid takes 15 minutes to go through the system. I'm probably not saying that right. So if you eat, like sometimes you eat meals and then immediately afterwards you have crazy diarrhea. And you're like, oh, that's probably the meal before because of how the intestinal tract works, right?
It can be a lot of things, right? Sometimes it can be just stimulating your lower bowel, right? It's just a stimulant that causes, but it's not the food going through you. That it is not.
It's not that
That takes
food
hours and hours and hours. But that food may be causing some, like caffeine will do that, right? Caffeine, they used to use it as a laxative. Right. So it's actually the stimulant property. It can cause some loose stool. Oh. And I wonder, I don't know that this actually happens, but it makes me think that maybe something in the food may cause your body to kind of want to move things through more quickly. So maybe that's the phenomenon we're seeing there. But it's not the food going through you. That takes hours.
But you're saying that maybe it's the food is letting off some sort of chemical signal?
Right. Much the way the asparagus can do so.
Oh.
Right? There you go. Sleep fucking follow-up. Put that on a loop. Hi, Hitlers. I want to chime in your mention of Sexsomnia. I've been doing this for years with my big-titted animal. I've always thought I'm just reading the words, guys. You can put that big-titted animal on a loop if you want. I've always thought it was linked to being tipsy when I go to bed. After some booze, I turn into a telescope, often with the opposite of the old whiskey dick, where I can stay hard after whitewashing my wife's vagine. Those nights I often semi-wake up thinking my wife has initiated sex, when in fact she has no idea until I've gotten her juiced up. Oftentimes she's plenty receptive, but consent is always respected. And a firm quit is enough to make me realize I'm trying to zombie fuck her again. Well, good. So you're not raping her. That's nice. I haven't been a great sleeper for years, but this was happening long before the sleep issues. Interestingly, my wife has also been known to break proto by coming in her sleep without masturbating. Good for her. So maybe she does initiate in her sleep once in a while. I'm not the only one. Sleep fucker, that is wishful thinking. You are the one with the sleep sex, not her. Thanks for putting a medical term to my seemingly inexhaustible nighttime libido. Keep it high and tight. Sleepless in meat traddle.
Meat rattle.
Meat rattle. Okay. Is that why is that? Tell me what that's about.
Well, when Tom and Christina would give off their tour dates and where they're going to be, they always changed it out with fun names, and meat rattle is what they call.
There you go. So here's the deal. This is interesting. This is not the typical sleep sex, because most sleep sex people do not remember it when they're doing it. The person that's initiating the sleep sex. In your case, your sleep is disrupted by booze, which is exactly what happens. Sleep's latency gets all messed up. And so you're sort of semi-awake, you're in what's called a hypnagogic state. And you, for whatever reason, get more aroused when you're like that. And you start thinking about sex, even though you're asleep. And you start doing what you would normally do when you're awake. Again, that's the thing about sleep, anything. Sleep driving, sleep eating, sleep sex. You can do the same thing awake and asleep. It's a crazy phenomenon. And you mentioned you've had a sleep disturbance for years, and that's sort of part of the deal. People that have sleep terrors, sleepwalking, are more prone to this kind of stuff. The good news in your guys' sleep sex is that your wife is open to it, and that when she's not open to it, you're not so deeply asleep that you don't respond to no. So good for you guys. This is optimal sleep sex, if there is such a thing. Let me hear another voice message.
Hey, I have a personal question. Do you think that if your boyfriend licks your butthole and then goes down on you, do you think you get an infection from E. coli and stuff? I just want to know to prevent UTIs,
Right.
Thank you.
Right. Well, interesting question. I mean, you generally want to avoid A to V. That's a nice rule for the reasons you bring up. A, you can screw up the vaginal flora and cause vaginitis of various types. And potentially you could cause a urine infection. I suppose that's not super likely, but I mean, if you're using a vibrator A to V, yeah, that's not great for your urethra, right? You want to clean that off. The mouth, though, interestingly, the mouth is sort of an inhospitable environment for bacteria generally. We get anaerobes in our mouth, right? That's why if you get dental infections, they give you certain anti-anaerobic bacteria, anti-anaerobic antibiotics. There we go. My COVID brain at work. But E. coli, I'm not sure it can really even can last very long in the mouth. I'm sure it could a bit, and it's worthy of being careful with this sort of thing, and having your boyfriend sort of pay attention maybe, and wouldn't hurt to wash his mouth out, a little, antibacterial mouthwash or something. But your concern is appropriate, but think about it this way. A lot of people engage in that kind of oral play, and there's not a lot of vaginitis or urinary tract infection caused that way. So yes, it's a thing. A to V is generally to be avoided, but I don't think it's a big thing when it involves the mouth. So good question. Give me another question.
Hi, Dr. Drew. I'm Rob. I was wondering, why do penises float in water if they are all muscle? I understand that typically adipose tissue floats, but penises are muscle and cavernous bodies, as Dr. Drew explained. So I'm wondering, are the cavernous bodies empty? Is that why it's floating? Why do dicks float in water? Thanks. Bye.
So what happened to my life? What has happened to my life?
The best thing.
So why do dicks float? There is no muscle or almost no muscle in a penis. This idea that it's a muscle, false. False. It is just a bunch of soft tissue, urethra, nerves, arteries, veins, and the two big blood-filled cavernous bodies, which when they are not filled with blood are less dense, and less dense than even fat probably. So I would say probably the penis floats better than fat in all probability. When it's filled with blood, obviously blood is a little more dense, and so the flotation is probably not as great. But it has nothing to do with muscle, which is a lot more dense. And not a muscle, everybody.
Fascinating.
Relax. You didn't know that?
No, I mean I think I probably missed that class at doctor's school, but I would have been like, yep, ding, 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 cavernous body. That's what it is.
Let's you would have, I'm sure of that. But let's put a picture of a penis in cross section up there, and let's see if we can see any muscle anywhere in that. Penis anatomy. There we go. Just the one on the left. That one all the way to the left. There we go. So can we enlarge that at all? So let's think. What's along the floor? Yeah. Oh. Good job. So I'm looking at a large penis cut in half. We see the dorsal nerve, the dorsal artery, the dorsal vein, the corpus cavernosum. The corpus cavernosum is this big fluid-filled body. The deep artery, which is what fills the corpus cavernosum. The corpus spongiosum, which is surrounds the urethra essentially. And the spongiosum, right?
That's the spongy part, right?
Well, it has to be able to get bigger and smaller too, right? Because this instrument is designed to shrink and get big, and so the urethra has to be able to elongate along with that. Do you see any muscle in there anywhere?
I do not, Dr.
Okay,
Drew.
thank you. All right, there you go. I have a condition where small and sometimes large cysts grow on my scrotum. Sometimes they'll be popped. The lumps get larger in size. I've been to several dermatologists, and they have mostly said these are sebaceous cysts, otherwise harmless. They're cosmetically toked. Look up at scrotal sebaceous cyst. You're going to like this. It does not look very pretty. Condition seems to be getting worse despite my attempts to proto. It's noticed and addressed by several women, I'm sure. Yeah, look at that. Nice, huh? Mm-hmm. Yeah. And there can be sebaceous cyst and spongy cyst and all kinds of nasty cysts. See if you can look up a spongy cyst. See if that's any different, what the picture looks like. Yeah, spongy scrotal cyst. Yeah.
This is rough, Drew. We didn't see any of this in doctor school.
No, you don't like these?
I can't show any of
this. Imagine you're a woman
you're
going down on a guy for the first time, and this is what you encounter.
Hold on, let me think.
And this,
I'd be terrified.
And poor Calvin, Tata there, he says, there's not a lot that can be, they can be taken, they can be surgically removed by dermatologists, but you're getting into trouble where they can get infected. And it's quite a... You're chasing your tail a bit with these things. All right, what up, Chomos? I drank a bunch of whiskey a while back. The next day I felt hungover like usual, but that night when I was Jing my D, I suddenly got this intense headache. Oh yeah, over the next few days when I would work out, I would get debilitating headache. I hope you got this evaluated, my friend. When I would try to jack off, severe headache. One night I had a nightmare, woke up with my heart racing, same headache. I called up my doctor and he just prescribed some ibuprofen, which worked fine, but I still get the headaches when I jack off. All the headaches are on the right side of my head. Is there something swelling in my brain? Will I ever be able to exert myself without taking medication again? I'd like to know. Piss on me, beat me. But when I see patients with these sex-related headaches or arousal headaches, and they usually occur after ejaculation, interestingly. Yours is occurring essentially with exertion. I have a neurologist look at them because it can be other things. Sometimes it can be aneurysm and things like that. It's very rare. Many times they're quite benign, or most often they're quite benign, but I think your doctor kind of blowing it off and saying take some ibuprofen is an inadequate approach to that. I think you should see a neurologist, get proper scanning done, and make sure it's not a warning sign of something more serious, which it probably is not. In all likelihood, it is not, but it's always worth getting that kind of stuff checked out. Here's a brown question. Does brown smear on your insides? Why do they think of these things? Does brown smear on your insides when it's going through you?
That's a great question.
Let's keep going. I know it'll smear on the sides of the bowel and shit gets on the edges of my pipes and my plumbing. Or does the brown get purged completely with no poo residual left in the butt? Okay. Look up. Do people get to see our pictures when we look them up? Do we post them somewhere?
If they're not too graphic, yes.
Okay. So look up inadequate prep colonoscopy, because this is what your colon is seeing. This, if we go up inside the colon with a colonoscopy fiber optic device, there on the right. Let's keep going. I'm sure you can find better than that. There we go. Okay, over on the upper left, that one. There you go. That's what your bowel has in it when it gets more solid when this is after somebody's had some prep, right? So you see this stuff, there's mucus and there's stool, it's all over the walls of the colon. Now this is a colon that's been, the perspective is crazy. You're trying to take the perspective of the wall of the colon. What does it see? Right now we're looking at a scope that's been blown up with air, right? There's air goes in to sort of blow the colon up. And you're seeing that it's designed with sort of a mucous membrane that everything eventually gets through, but there's always some stuff left on the side there. I don't know how else to imagine it other than what it might do to your mouth. Think about it that way. I mean, it would kind of eventually get through, right? You'd push it through. So speaking of pictures, let's see a preacher who tells a woman not to be fat.
Why is it so many times that women, after they get married, let themselves go? Here's how way too many women are. I got him now. The chase is over. Hey, that's where you're wrong. The chase ain't never over. The chase ain't never over. And by God, if he don't love me the way I look now, he ought to look at his own spare tire in the mirror. Now look, I'm not saying every woman can be the epic trophy wife of all time, like Melania Trump. I'm not saying that at all.
Oh, he puts her picture up.
Most women can't
is that
be
Melania?
trophy wives, but you know,
that's an example
like her,
of a trophy wife. Oh my God, that's funny.
Trophy. I don't know, but all I can say is not everybody looks like that. Amen. Not everybody looks like that. But you don't need to look like a butch either. Hey, here's something you need to know. You need to know this. Men have a need for their women to look like women. Hey, sweatpants don't cut it all the time, huh? Wearing flip-flops and pajamas to Walmart, that ain't gonna work.
This guy's attacking mommy jeans.
About that.
What about mom jeans?
And when men want their wives to look good at home and in public. Can I get an amen?
Amen. What an asshole, right?
Yeah, this guy sucks.
He's an asshole. Yeah, he sucks. And by the way, not the most svelte preacher on earth. Speaking of spare tire, the guy would die of COVID if he got it for sure.
Yeah.
You know what I'm saying? He's in that zone.
What mental illness is it that someone that looks like that, it's just like, there's nothing wrong with telling a woman to shape up?
It's narcissism.
Narcissism.
Yeah, it's narcissism. I mean, come on, that's what that is. And I'm all in favor of telling couples to take care of, for each individual to be taking care of their bodies so they can look their best for their partner, but to lay it all on women.
Can I get an amen?
This dude is sexist. Amen. All right, enough of that asshole. But there's something really, I'm too offended to get to laugh, but he's very funny. There's something very, very like ironic. This big fat dude sitting up there. I mean, this guy that is like obese with, not just obese, he's got a beer belly.
Extremely obese.
It's very, very appealing.
This guy's getting the vaccine pretty soon.
Releasing bear into audience sounds like something I'd like to see. Isn't that hilarious or a disaster?
The horrible or hilarious?
Horrible, hilarious, releasing a bear into the audience?
Well, it's kind of like a fun lane that we have where it's just like, look at these people getting way too close to dangerous animals.
Okay,
so
got
that's
it.
What
All right, let's go there.
The door is up, the bear is out. Oh, whoa, whoa, he just went for it.
This is a wild bear.
Come on, May.
May. Go, May, attack the people. Oh, no. He got one.
I mean, he didn't actually attack that person. He just dived on top of them. They're shooting up in the air to try and scare the bear away. I'm feeling a bit uncomfortable about this.
I feel a bit uncomfortable about
literally shooting AK-47s into the air.
Oh, now he has an Irish accent, doesn't he? Is that what I heard?
I think it was more British.
I thought I heard a little Irish brogue.
He just dived on top of them.
Let's hear him.
They're shooting up in the air to try and scare the bear away.
Away, the bear away.
Oh, yeah.
Yeah, so he's Irish. I saw 2 different flags, and I think a Russian, outfit. Where is this? Do we know?
This is at the United Nations.
No, seriously. I want to know what country does this, is what I'm asking.
I think definitely some offshoot of a Russian country.
Right.
Like
that's
Yugoslavia.
That's what I
Ukraine,
think. I think the Russian bear is the whole symbol here. Right. So that's what I think. And I don't think a way to pay homage to the Russian bear is to torture it, guys. I think that's not a good thing. But there you go. People have all kinds of things. Do you have any other animals in Released on People video? This sounds like a great corridor I'd like to go down.
Yeah, it's we'll get some. I think we've showed you it's once in a while. It's like the people open mouth kissing wolves and stuff. I think.
Oh,
you've seen
that one still is in my head.
Yeah, it's.
And when my dog tries to do that to me now, I kind of know why.
Because it wants to get acquainted with you.
Well, that's what the alpha dog. That's what the male dogs do to show affection.
So, do you open your mouth and let them
usually
show affection?
Not always. Have to be into it.
Okay. So it's a sometimes thing.
Right. But at least I know what he's doing. I kind of get. Right. I get it.
Nothing sexual.
Right. Well, it's spring coming up, and as you get back to the outdoors, explore. Take Bespoke Post on all your adventures with a new lineup of essential box of awesome collections for guys, guaranteed to upgrade your life. You've heard me talk about this for quite a while now. I love the outdoor barbecue kits. I like the tool kits, the blankets, the cozy stuff I've been using during the winter. So whether you're out taming the wilderness or taking your home bar to pro-level heights, Bespoke Post only sends guys the very best stuff every month. No matter what you're into, Box of Awesome has you covered. From style and grooming goods to barware, cooking tools, outdoor gear, Box of Awesome has collections for every part of your life. And to get started, you take a quiz at Box of Awesome, one word, boxofawesome.com. Your answers then help them pick the right Box of Awesome for you. It's very simple, and I kind of dig it. It helps you get a sense of what they're planning for you. And they release new boxes every month across a ton of different categories. It's free to sign up. You can skip a month or cancel anytime. Each box is only $45, but has over $70 worth of gear inside. And to get 20% off your first monthly box when you sign up at boxofawesome.com, enter the code Dr. Drew, DRDRW, at checkout. That is boxofawesome.com, code Dr. Drew for 20% off your first box. Well, the future of toileting has arrived. Okay, it's technically been around for centuries, but hideously expensive, costing thousands. Now, the brand new Hello Tushy 3.0 modern bidet attachment is here to level the playing field. It's stylish, it's eco-friendly, easy to install, affordable. Hello Tushy 3.0 doesn't just cleanse your butt with a precise stream of fresh water. It cleanses itself before and after it's used with the Smart Spray automatic self-cleaning nozzle. It attaches to your existing toilet, requires no electricity or additional plumbing, and cuts toilet paper use by 80%. So the Hello Tushy bidet pays for itself in a few months. And because Hello Tushy, you don't wipe at all, just poop, spray, and go. Sanitation is simple, and the Schmutz Shield offers easy cleaning, and the knobs are naturally antimicrobial. If you already got a Tushy for your pot, upgrade to the new 3.0 model. If you're new to the revolution, join millions of happy Hello Tushy customers right now and have a clean butt with every flush. I have to tell you, my daughter has been admonishing me and my wife for not having it. She claims she's going to buy us one, and she regales us with how easy it is. It's a sleek bidet attachment that clips onto your existing toilet and sprays your butt completely with clean water. That's why it's called Tushy, and it's the best thing you can do for your butt. So what I want you to do is go to hellotushy.com/Drew to get 10% off your order and free shipping. Hellotushy, one word, .com/Drew, 10% off. Go now. Girl in Septic Tank. Now, hang on. I need to prepare for this. Just the title of that reminds me of our man in full leather garb in Septic Tank. Yeah, are we going that far in here, or is this
is close? But I think this is probably going to upset you a little bit more.
Oh no. Okay. Oh!
That's right. No protective.
Oh, no, that can't be. That's got to be fake, right?
So how soon after this video do you think she got admitted to the hospital?
I'm thinking I can't get past I can't even think that far ahead.
Like, she doesn't have goggles on. She has nothing on.
Oh, my God. It's got to be. That's what I'm saying. It's got to be fake. I mean, it's just right? I mean,
I don't think it is fake.
Oh, my God. So we're looking at what, looks like a vat of stool that a woman descends into. How if you like watching shit like this, how much do you have to hate women? You know what I'm saying? I just don't get it. I just don't get it. Is there any follow-on? Do we see? Does she run out and take a shower? Can we get a payoff here of some type?
It's a one and done. It's just you see the dip.
And that's it.
Yeah.
And we have to look at her covered with stool like that. Like she looks like a giant.
Yeah, that mud's everywhere, huh?
Mud?
Yeah, she got chocolate all over the place.
I hope that's mud. Annie explained to us I'm having an interesting brain phenomenon. Annie explained to us on the last show that when he sees when he sees bad things in videos that Tom shows him, he feels bad for the person. But when he sees truly horrible things where people are just disintegrated, he just doesn't feel anything because it goes into like that can't be, or that's just I can't relate to nothingness, which is vaporization of somebody. I have the exact same reaction with this one. My brain just goes, well, that's not true. That can't happen. I don't care. It's mud. I don't care. Does not compute. I don't want to hear any more about it. Let's move on. Let's see it one more time, though, just so I can test myself. See if my brain can possibly go there. No. I like especially that she's like got pristine white skin and stuff. I mean, she's like super clean going in, and then all this. Okay, that's enough of that. I wish Jen Kirkman were here though, because if you remember, we showed her the leather man in the septic tank.
Yeah, I think that was the first time you ever watched
the first septic tank video. Jen very nearly vomited. She very nearly vomited. It was close. Remember?
Yeah, it was a great reaction.
It was a lovely reaction. I hated torturing her like that, but it was epic. Okay. Can we have some TikToks maybe to kind of fool around with? Then we'll go back to voice messages.
Sure.
Yeah. Nice pan. Oh, I see. So he's doing the splits, holding his nuts. What's it say? What does it say on his vest? Can you guys read that?
I think it says Walmart.
Oh, it says Walmart. It does say Walmart. Yep. And then he had to be the greeter. Welcome to Walmart.
Yeah, this is one of the qualifications to be
I like that.
Walmart greeter.
And this is just, hey, look at me. There's no other payoff to this TikTok.
This is the whole thing.
All right. Well, we looked at you. Congratulations. Give this man a raise. Next.
Good morning. Coffee's ready. Bacon and eggs will be up in just a minute. Driveway's already shoveled, and I don't have to be at work for another half hour. How would you like to spend the rest of the morning?
This is somebody who studied with the king.
Yeah.
This dude studied under the king.
Right.
And again, is he looking for tit pics, or what's he looking for? What does he want?
I think he's looking for ladies to slide in his DM. He's just like, hey, you want to do this role play thing? Look how good I am at it.
Oh my God. I just gotta see what these guys get on the other side.
Right? Like, what is their success rate like?
Yeah, I'm zero interested in this screwball, but whatever he generates. And now I told you what it's like to be the object of King's affection. Feels pretty good. So I get what they feel. I don't get responding to it. I did not send him a video back. I sent him no pics. Trust me. But by the way, this guy, is that windows behind him?
I think that's a microwave.
Let's see the video again, just so I can look around the room he's in, because I want to set the scene here a little bit. Oh, it's a microwave. Yeah.
Good morning. Coffee's ready. Bacon and eggs will be up in just a minute. Driveway's already shoveled, and I don't have to be at work for another half hour. How would you like to spend the rest of the morning?
Oh, you're such a man.
He's pretty much just saying like, hey, let's fuck, right?
I think so, but I don't actually know if he's looking for women or men. You know what I mean? It kind of
could be both.
Probably gets both. All right, good on you, mate. You said a TikTok showing us what you get. That'd be very interesting. All right, so let's go to some voice messages.
Hey, Dr. Drew. My name is Jared, and I am calling because when I was younger, I had an undescended testicle, and so I had to have surgery to get it pulled down and properly tacked into place. I was wondering if my chunky whites have anything to do with that and not creating enough seminal fluid or what have you. I don't know. Sometimes my whites can be pretty chunky. So, yeah, I was just wondering about that. That's the hole. That's where it's fit. Thank you.
Well, dear Tapioca, yeah, no, it has nothing to do with it. The reason they pull the testy down is to prevent it from becoming cancerous, which if it stays up in the abdomen where they start and they don't descend from there, they can become cancerous. So they pull it down, put it in the sac where it belongs. Sometimes that testy doesn't work quite as well as the other one in terms of producing testosterone and sperm, but that's about the only issue. But men have got to get through their head. The testes only produce the sperm. They don't produce the fluid. They don't produce the white. They don't do any of that. That's all the prostate and the seminal vesicles that the sperm just drips into. Okay, the sperm is in a fluid, but it just sort of drips a small amount of the fluid that's produced by the prostate. And when stuff sits for a long time in your seminal vesicles, sometimes it can form little coalescent little chunks like that. And looks like tapioca pudding in that case. So, do you know what tapioca pudding is, Nadav? You ever heard of tapioca? It's not very popular these days.
Yeah.
Okay, good.
Yeah, tapioca fucks.
Why can't they let go of the idea that somehow see their testicles as the thing that's being emitted during ejaculation when it's not involved during ejaculation?
Yeah, some of these dum-dums didn't go to doctor school, am I right?
I'm just saying, it's we have this thing called the internet now, and people know most silly things like this. And we talk about it every week on this show. I just don't understand why people can't get that. Men just, even when you tell them, I don't think it stays with them. All right, give me another voice message.
Hi, Dr. Jeans. I'm JR from Washington. I had a question about dead people brown. When a person dies, they shit involuntarily because they're dead. I'm wondering if, hypothetically, an alive human could brown in the same way as a dead person, possibly by loosening the muscles enough. Thank you, and keep it high and tight. You bet I'm coming up in May.
Okay, thank you, buddy. You've been watching too much South Park because it seems like everybody who dies on South Park always shits just before they die. And that's not always the case, though if there is something in the chamber and when the muscles do relax, that can happen, but it's not much. And anything that causes alteration in consciousness or, loosens the muscles in that kind of same way, yeah, that can happen. It's sort of more like it leaks out kind of more than anything. It sort of spills out. It's not like it's suddenly coming down the way any would do it. But it's a weird question. Give me another voice message.
Hey, this is Jen. I have a question. Is it okay to shit with a tampon in? Asking for a friend. And how you say cucumber? Thanks.
100% fine. Enjoy. I wonder, you could, if you're pushing hard, Rob, right, you can push the tampon down or out. It might be uncomfortable, but enjoy the passage of your bowel movement with the tampon in place. Next question.
Hey, Drew. This is Lee from Ohio. And I was just wondering if, after a man transitions into a woman, right?
Okay.
I guess the bottom surgery and everything.
Yep.
Do they if they can come, do they still have a refractory period? Thanks.
Sure. Yes, of course. Whenever anybody, you mean can they have multiple orgasms like a female?
Exactly.
Yeah, it's pretty much the same function. I don't know of any, I've never spoken to any female transsexuals who have described their orgasmic function changing in some sort of fundamental way, so they're having more, no, I don't think that happens. I could be wrong. Straighten me out on that. Fact check me, but I've never spoken to, and I've treated a lot of transsexuals over the years, and those kinds of issues come up, and it's that seems to be a strictly how do we characterize that? A born female? What do we say? What's the proper terminology?
Biological?
No. Somebody who's
female at birth.
Female at birth. That seems to be in the spectrum of what they can do biologically. Another voice message.
Hey there, Dr. Drew. I have kind of a weird question. So I have a curved thing. My dick is curved, right? And it's at kind of a severe angle. I don't know when this happened, but just, one day, I kind of realized, hey, most penises don't look like this.
Mm-hmm.
So I started Googling. I found out about Peyronie's disease,
Mm-hmm.
and I think I have it. Now, so far in life, it really hasn't been an issue, but occasionally, when I'm with a lady, it can be painful for me, depending upon the angle in which I'm beating that thing up. So my question to you, Dr. Drew,
He
is,
clears his throat.
do you recommend getting therapy for it? As far as I can see, really the only scientifically proven way to cure it is surgery. But it sounds very unappetizing because it shortens the length of your hog.
That's right. That's true.
And I'm already not working with really a whole lot to go on.
Congratulations.
So, what do you recommend for somebody who's in this predicament?
Yeah.
Thank you very much. Love your show.
Thank you,
Appreciate
man.
it.
Good question. Well researched, well thought out. You're on to it. It is Peyronie's disease. Peyronie's, you intervene typically when it's affecting functioning. If you're having painful erection or your partner's complaining about pain. Now, if you're with a stable partner and it doesn't really bother her, I wouldn't, there's bad Peyronie's he's showing me pictures of. Sometimes it can even look like a hockey puck where the hockey puck where it just is at the very tip. Actually, that's often not Peyronie's, but a scarring from botched circumcision. But Peyronie's, again, yes. But there are some newer treatments coming for Peyronie's that look really good that are non-surgical. So what I would suggest you at least meet with a urologist to see if there's, again, it depends on the degree of Peyronie's and what the plaque feels like that's pulling the penis to that side, and whether you're having real problem functioning, whether your partner's really complain about it or not. But it is worth a consultation to see if one of the newer treatments that don't require surgery might be an option for you. Yeah, good question. Give me another one.
Hey, mommies.
Hi, mommies.
So my question is about chapstick. Can you be addicted to it? And if so, is it something that you can break? Is it an OCD thing? I've been using chapstick since I was a smoker when I was 17. And I haven't smoked in 7 years, but the chapstick never stopped. The second I don't have it, I start licking my lips. I, freak out. I need to go and buy some right away. Otherwise, my lips feel dried out. There's never a time when I don't have chapstick. So anyways, what's that about? Anyways, keep it high and tight, and you better believe I'm coming up in May.
You better believe. So it turns out there is. I didn't think there was such a thing as a chapstick addiction, but it turns out there is. There's something in the chapstick that there's a little rebound from that if you're using for a while starts to motivate you to use it again. And of course, it's good for the chapstick people, and I guess that's why they leave it in. It also is a little bit of an OCD thing. You have to tolerate a little period of dry lips and maybe some cracking, not feeling so good. Maybe a little topical corticosteroid, the hydroxycortade, something like that. Put a little bit of that on as opposed to the chapstick for maybe the first week after you try stopping, and then get off it. But you have to go cold turkey, and you have to be willing to have a little bit of discomfort, and you have to kind of manage some of that OCD stuff. But I think some Cortade instead of the chapstick, not a lot of it, like maybe 3 times a day, Cortade might help you get through that interval of a week or two when you're trying to break the cycle. So yeah, does happen. Let's go back to some more videos. Sex addict cool guy sounds kind of interesting to me, so I'd like to see what this guy's up to.
I came to Los Angeles from the deep south. I quickly became a sexaholic. Raw, hard pounding. I crave raw, hard pounding. The sheer dominance, getting filled. You could say it's a different kind of horny. There's a fine line between pleasure and pain. My pain tolerance is a bit higher than the average bear. Testing myself, and I got a big hand. I'm mainly a bottom. Never hung out with anyone my size or smaller, or nowhere near smaller, no, fuck that. Are you familiar with the power transference relationships? No. Have you heard of the cage? No. It's a cage that holds you in a down on all fours position. So when somebody has friends over for dinner, they also have dessert. You get to a certain age where life just can't shock you anymore.
Ooh, look at his eyes. Whoa.
Nothing traumatic happened to this guy, right?
Yeah. And this sort of should have been hilarious or horrible. I don't know quite what to do with it, except that this is a very sad story. And this is, some guys that develop these sex addictions they can't control. This is where it goes. And oftentimes that's trauma. And in my experience treating men like that, sometimes they had some horrible stuff happen to them when they were a kid that they're sort of reenacting. And one of the extraordinary things about the human being is that when we have things that are traumatic interpersonally, like somebody does something to us, physical abuse, sexual abuse, particularly people that we are drawn to for attachment and safety, when they turn around and traumatize us, that actually increases the desire for attachment to that figure, and it scrambles our ability to regulate our emotions. And strangely, we are driven to be attracted to. People don't talk about attractions enough, but one of the sources of attractions is trauma, and we are magically attracted to people and places that are just like the people that have perpetrated the trauma during our childhood. And as such, when you get around people or you're in a circumstance was just like the one that was traumatic, guess what? Those people oblige you by doing it again because you're a perfect instrument. Your attraction takes you to people that are just like that, and you have no idea you're doing it. It's sort of the classic thing for many women that I have dealt with, the abandoning father, and then they're magically attracted to men that are kind of abandoning. That's a sort of a simple version of the same thing. And even when the partner does not look anything like the old partners, it's like, oh, this is a guy that will never be like that one. If you're attracted, like you're really very, very attracted, and you have that pattern, our bodies are perfect instruments. They will always get us back to somebody that does the same thing. That's just how our body works. It's not funny at all. But it's peculiar how we do that. And one of the ways to mitigate that, if the trauma wasn't really severe, is to go for people that aren't. We say think about butterflies rather than lightning bolts in terms of your attraction. If you have a pattern of being super attracted to people that repeat the past that you'd like to change, maybe next time go for somebody that's not quite as exciting, more butterflies than lightning bolts, we would say. And if you can't do that, or if you can't sustain a relationship with that person, you keep sabotaging it, then much like that guy, you must get some treatment. And that guy needs a lot of work, I'm sorry to say. Let's see.
We're going to cleanse the palate for you.
Yes, that's what I was thinking.
Because I just found a TikTok that's in the lane that you liked earlier.
All right. Okay, good. Let's do it. Oh, boy. Oh, boy.
Oh, it's a nice massage.
And then, boom. And pow. Is that Carol? What's her name?
Carol Baskin.
Carol Baskin? Is that Carol Baskin?
No, that's just a crazy person that is petting a tiger.
Does it keep going?
No, that's it. That's the whole TikTok.
I had in the whole Tiger King thing. What was Tiger King? That was what the video.
Yeah,
Tiger King. I admired that girl that got her arm taken off by a tiger because she was like, yeah, I wasn't careful enough. That's what those cats do. They just tear your arm off.
Isn't that Stockholm syndrome? It's my fault.
Right? No, because she literally was careless that morning. Look, as opposed to someone who goes in and starts hugging the tiger, she knows better than to do that. And I always thought, she doesn't blame the tiger for being a tiger. That's what I'm saying. That's not Stockholm syndrome. That's having realistic expectation of a wild animal.
Right.
So.
No, right. If the tiger was a person and she said the same thing, then it's Stockholm syndrome.
Then it is Stockholm-esque, unless that, I don't know, there might be different variations on that theme. Let's face it, trips to the post office is likely not how you want to spend your time. And that's why I recommend our friends at Stamps.com. You ship online. Stamps.com allows you to mail and ship anytime, anywhere, right from your own computer, your own desk, your own office, send letters, ship packages, and pay a lot less with discounted rates from the U.S. Postal Service, UPS, and more. And with Stamps.com, you get the service of the post office and UPS all in one place, plus big discounts on mailing and shipping you really can't get anywhere else. I love Stamps.com. We were early adopters, and I stand by them. Stamps.com brings the services of the Postal Service and UPS right to your computer. Simply use your computer to print official U.S. postage 24/7 for any letter, any package, any class of mail, anywhere you need to send it. And once your mail is ready, just schedule a pickup or drop it off. It is that simple. And with Stamps.com, you get discounts up to 40% off the post office rates and up to 62% off UPS shipping rates. Not to mention, Stamps.com is a fraction of the cost of those expensive postage meters. Stamps.com is a no-brainer. Save time, save money. It is no wonder why nearly 1 million small businesses already use Stamps.com. Stop wasting time going to the post office. Go to Stamps.com instead. There's no risk, and with my promo code Dr. Drew, you get a special offer that includes a 4-week trial, plus free postage and a digital scale. No long-term commitments or contracts. Again, just go to Stamps.com, click on the microphone at the top of the homepage, type in Dr. Drew. That is Stamps.com, promo code Dr. Drew, Stamps.com. Never go to the post office again. But is there a fart couple that I need to see?
Oh, yeah. I think you're going to love
Okay,
this.
also palate cleansing, hopefully.
Oh, putain. En plus, c'est tout ça les caméras cachées. Allez! Oh! Il y a personne qui met avec. Oh! Oh, dis. Ah! Oh, dis, allez!
She got scared there.
I know. I like when they scare her.
Allez, enfin!
Oh, it's French she's speaking.
Oh.
You know what she said?
Oh non, allez, putain, c'est pas possible.
First she said, well,
Ah, allez, je suis à poil.
first she said, finally. And then she said, that's just not possible. And I don't know what a poil is. Look it up. French English. You're unpoiled. P-O-I-L-E. I think it was just poil. P-O-I-L-E. P-O-I, poil. L-E. Francais. Yeah. Poil. Hair. Wonder what she's talking about. Or I just did my hair or something. Anyway, what she doesn't understand is all that, and the way she reacts makes her more attractive to her husband and more likely that he's going to do this. Don't you agree?
Yeah.
Yeah. I mean, she is setting the table for him to just keep it going. The daughter, however, I think is going to lay down the law. She did not dig it at all.
Yeah, she's going to not take that from her future
Yeah, as soon as you laugh or if you laugh, it's on. And this is what Mike Cathroyd, my old Loveline partner, used to say and terrible things to women and send them horrible pictures and fart on them and things like that. And they would laugh. And I would just go, you don't laugh at him. If you laugh at him, it's coming back. It's coming around again. And you see, that guy was pretty prolific with his gas too. I wonder if Tom's mom was like that when she was younger. What do you think?
Ooh.
Right? Couldn't this be Tom's mom?
Like it was positively tied into her at a young age?
Well, I could see her reacting like that, at least, let's say. No?
Yeah, no, definitely.
Yeah.
But I don't think she sounds like this, you know? It's it's more like, I Tommy.
Well, if they're French, it's different. It's different.
But then she also farts herself. You know, it's like she likes the farts.
Well, I'm wondering if but see, I think this woman down the road may be broken in like Tom's mom. You see what I'm saying? Like, I think the males in Tom's life brought her to this place.
Oh, I don't know, man. I feel like if you have farts like that at an old age, you've been farting like that your whole life.
Not necessarily. I think she's just going with it.
No,
she's going with it.
Look, long farts don't start at 50 like some other things. All right, I think she was doing the long farts for a long time.
Just use your imagination for a second and think how those two things might go together. See? Maybe. I'm just saying. Yeah, you don't want to think about Tom's mom that way, but I'm just saying.
I see.
Yeah. Oh, good. You see.
I see. Did Susan start farting a lot more after 50?
Again, we sort of brought her along. She has 2 boys and myself. It took a while. But I think we've indoctrinated her a bit. Yeah. And then you add that to the mix, and it's sort of a whole soup for destroying female sensibilities. You know what I'm saying?
I know exactly what you're saying.
So, if we have any more voice messages, let's keep going.
Hello, mommies. My name is Maddie. I was just diagnosed with ulcerative colitis back in 2019, but I'm still interested in doing some anal play stuff. Is that allowed? Am I going to make it worse? I don't know. So I'm asking you. You're the experts. I don't know shit. That's all. Thanks a lot. Have a good day.
Well done. Ulcerative colitis is like Crohn's disease. People have heard about Crohn's these days, except ulcerative colitis is limited to the colon. It's an inflammatory disease of most of the colon, and it's highly treatable. So the good news, it sounds like you're fine with it and probably under control. So the extent that it's under control, you're probably okay. I don't know that it would stimulate trouble. Maybe you feel embarrassed asking your gastroenterologist about it. If you're under control, like you're having no diarrhea, no mucus, none of the UC ulcerative colitis symptoms, I think you can give it a try. But I'm not sure I would allow him to ejaculate in there because it might stimulate some stuff, it seems to me. But the actual act, it's so far away from most of the colon that I think you're in pretty good shape. Again, calling me an expert in this is a misnomer. I've been asked this question over the years, and I would usually say no. Because back in the day when I used to get asked this question, we didn't have such good treatment for ulcerative colitis. So now that the treatments really are quite remittive, I think you're okay. Give me another one. Good question.
Hey, Dr. Drew. My name is Reagan. I hit my head recently and lost my sense of smell. And I've been doing some research. It says it's a 30% recovery rate, maybe, after 6 months to a year.
Yeah.
And I was wondering, how fucked do you think I am? And I didn't lose my sense of smell from COVID. I tested negative the day before it happened, 2 days after, and multiple times after that. So, yeah, I was just wondering.
Wait, what did he say 2 days after?
Do you think I am?
Yeah.
Thank you.
Day before, couple days after, and then multiple times after that.
What?
Tested for COVID.
Oh, he doesn't have COVID.
Right.
Okay. Yeah, the head injuries can do this. It depends how bad the head injury was. I mean, if it's just a sort of an incidental thing, you notice your sense of smell went away. Yeah, it'll come back in all probability. But if you're someone who was in a hospital with a coma for a week, not as likely, right? It's a more severe head injury. Even then, I would think it'd be in the range of a third or so. So yeah, you've looked into it. It's not pleasant, but some people do lose their smell permanently. Another voice message. Look at his good questions.
What's up, mommies? How's it going?
Hey, man.
This is Terry.
Terry?
Oregon. I'm 52 years old, and a lot of people I talk to say that your balls keep growing and sagging farther down the older you get.
Yes.
But mine seem to kind of be doing the opposite.
Oh.
Like, my balls are really high and tight. Like, they don't even hang down a little bit. And it's not that my balls are small. They just don't hang at all. So, anyway, just wondering if that's some kind of a medical thing that I should get checked out. My balls are high and tight. So you guys keep them high and tight. I'm coming up in May. See you guys then.
You bet you are.
Ooh, I think I know this one, Drew.
Tell me.
He's got way too much cum in those balls, right?
No, it's not that. It is. It's not uncommon at all, and it sometimes has to do with aging. If you're getting more overweight, the key though is to make sure that they're still producing as much testosterone as they should. And if you're not having other symptoms like lack of libido or lethargy or depression, things like that, I wouldn't worry about it too much. But it's something definitely to bring up with your physician to make sure he or she is not seeing something that they're concerned where your testes are sort of failing, so to speak, and there may be some shrinkage from that. Next.
Hey, Dr. Drew, this is Oren. I got a question for you about female psychology. So my girlfriend is really afraid of going outside by herself, especially at night. She's really reluctant to do that, only if it's with me. So my question is this something that she can maybe get over with some sort of defense training, or do I need to talk with her about it? Is this something that I can help with, or are all women just afraid of going outside? I know that they experience life differently than we do as men.
So let's hold.
But what can I do to help her feel more comfortable and experience the world at night? Because that's half of our time here. So let me know.
So
bye, mommy.
Okay, bye, mommy. This kind of I again need more information. I mean, is he talking about, I live in the woods and she's afraid to go outside because of a wild animal, which is realistic? Or are you saying that when the sun is down, she's unable to leave a house, her home? That latter case where she just can't go out in the evening hours from, whatever, and I'd like to know what kinds of vicinities she feels comfortable in. That's agoraphobia. That's something different. And by the way, none of this has anything to do with being a female. Trust me on this. All of it, whether it's going out in the woods or overcoming agoraphobia, responds to exposure therapies. So it's about finding somebody who's trained in leading people out intolerable doses to be exposed to the thing that they're paranoid of or having a phobia of. Agoraphobia, you wonder also, does she have other anxiety? You wonder if there's any traumatic stuff attached to it. So there's a lot going on here, and it has essentially nothing to do with being a female. So you need to ask a lot more questions about what's going on with her, and then find somebody who can do the exposure therapy to help her through this. Because you're right, a lot of her life is going to be missed if she can't go outside when the sun is down. That doesn't even make sense. Does that make sense to you, Nadav?
Nah, I feel like there's probably some sort of traumatic thing.
Well, maybe
that happened.
That's like I said, you should ask that as well. And
Right.
But again, the treatment still could be just exposure therapy. You can get trauma therapy also, but just getting through this one problem needs to be.
Therapy is definitely a good idea.
Somebody who knows how to deal with this exposure therapy. Let's see, have we done all the TikToks?
We have a couple more.
Okay, let's see what we got.
Sometimes you have to train the person you're dating. What I mean is, if you expect flowers every day, then you have to tell them that you expect flowers every day.
What? Shocking. That's shocking. Yeah, because doesn't everybody expect flowers every day? I mean, why would your boyfriend not bring you flowers every day? Yeah. Next. Train your man. But it's a dating tip. Ooh.
Arthritis is painful.
Uh-oh.
It hurts my big toes.
Mm-hmm.
It hurts. Yeah.
Okay. That is an interesting cranium on that. Is that a male or female? Do we know? What was your guess? Male?
Let's see. The tag is Super Chloe one.
It sounds like a female. Super Chloe. I don't want to make fun of Super Chloe, but something going on. By the way, I told you I set up my new TikTok. I went from Dr. Drew Pinsky to Dr. Drew.
Oh yeah.
And when I did that, I started scrolling through TikTok just to see what was coming up, since that I had no algorithmic track record with that a new website. And man, a lot of cool guys came up. I was surprised how many cool guys. I almost sent them all to Christina.
You got cool guys out the gate?
Yeah, but I didn't necessarily want to be looking at cool guys all the time, so I didn't spend time on it or look further. I just figured Christina will find these people.
You want to see the attractive people dancing and singing and stuff.
Which also comes up automatically in my stuff.
Right.
Yeah.
But the fact that you're getting cool guys right from the start, I mean, I feel like maybe, we're changing the way TikTok is used, where people are actually seeking
I think
these
we're
out.
having a measurable impact on the algorithm. I think that's exactly what this means. That's exactly what I thought to myself. It's like, oh boy, we're affecting TikTok now. Is there any last voice messages to wrap up with?
Yeah, here, we got one more.
Yeah.
Hey, Dr. Jeans, long-time listener, first-time caller. My boyfriend and I are a part of the Anal Under 50 Club. He insists that the brown hole has more nerve endings than the clit, and therefore I could come exclusively from anal. I could probably Google this, but I wanted an explanation from the expert himself.
Yes.
I'm also wondering on his behalf if jaying the D excessively for an extended period of time, say a deployment, could lead to reduced sensitivity long-term. Thanks, Jeans. Live like 365.
All right. Great questions all the way along. The D does not get desensitized the way the C does, the way the clitoris does. That's kind of interesting. Mostly because men aren't using vibrators and stuff. The high intensity vibration that does the desensitization of the nerves. What can happen with the guy J and the D, though, all the time while he's on a deployment is he gets kind of used to that, or he overdoes it, in which case he kind of loses libido and have decreased sex drive and sort of be still preoccupied with his pornography. But again, it's not about the act of masturbation then it's the pornography that's really the problem. But if he didn't have a problem with that before, I doubt he's going to get into that issue. Now, in terms of you being able to orgasm with anal sex, he is looking for a unicorn. He's hoping that you're a unicorn, and you are not, because you would know if you were a unicorn. People that know that they can have orgasm with anal sex know that they can have orgasm with anal sex and will request anal sex, because that's what that is for them. For you, I suspect you're going to be somebody that needs some sort of direct stimulation, like oral sex on the clitoris. You probably don't orgasm with vaginal sex either, because most women don't. They need, again, some sort of direct stimulation. And that's normal, and that's good. But wishing it to happen in the anus, there is a lot of nerve endings there, no doubt about it. And you may like it but you're not going to, in all likelihood, have an orgasm there, unless you're also bringing in something to stimulate the part where you do have an orgasm. So how about that? All right. One more. We have one more. We have one more something.
Yeah.
All
We'll
right.
get you another one.
All right.
Hey, Dr. Daddy. My name is Gary. I've got a question regarding the difference between sexual validation versus sexual addiction. I consider myself a full-blooded man and feel the need to have sex quite often. My testosterone is quite high. However, whenever I'm rejected from sex or whenever a woman doesn't feel the need to have sex with me, I feel like it's really kicking me down a few notches. So is this coming from the fact how I'm looking for validation through sexual acts, or is it from the fact that I'm actually addicted to sex and I need that to really tick some boxes?
No.
Kiss me, beat me. Thanks, Daddy.
Yeah.
Bye.
No, there's nothing about that says sex addiction. That is what I was talking about earlier in terms of how really tender the whole act is for men. And when a woman isn't willing to sort of acknowledge that part of us, we can be very affected by it. Now, if it's somebody you don't know and these are sort of new relationships and dating and new hookups and stuff, adjust your expectations. I mean, come on now. And realize that not everyone's up for what you're up for, and it has nothing to do with whether they're attracted to you or not. I think you're a good person. They're just not up for that kind of sexual activity. And of course, you're going to be frustrated, and part of that frustration may feel like a rejection, and part of that rejection may feel wounding. But this is all more in the, I'm sorry to tell you, buddy, more in the sort of narcissism zone than in the sex addiction zone. And while I'm sure that you could get into the sex addiction stuff, that's more about more serious consequences in relationships because of cheating and money and inappropriate or illegal and all those kinds of activities are highly arousing that people get into when they're addicted. So, well, this has been fun, everybody. Nadav, I enjoyed doing this. I enjoyed just answering your questions and looking at a few videos. I think we got a lot of material out today, and I'm having trouble getting over seeing that poor young lady descend into the stool. But maybe you could show it to me again just to wrap up here, because it was for me the moment of the day. It's not just the cesspool man in leather, it's the cesspool Snow White Disney character going into the cesspool, and somebody thinks that's arousing, I guess.
I only exist to make you happy, Drew. Here it comes.
There's something about her being so pristinely clean when she goes in, and I'm just saying I'm sure that is like pulled pork and mud that she's all around, not stool. That's
just noticing.
Uh-oh.
Is that it looks like she took off all her clothes.
Is that clothes? I thought that was
just
just
over here in like a dirty, shitty pile.
See, I thought that was all just more trash strewn around, because to make it look like this is a real cesspool, which I would not believe for a second.
So you think they're just dressing the set?
Yes, exactly. This mud pit that I'm hoping this is. Anyway, again, I'm having my usual reaction is I want to meet this girl and talk to her. I want to see what's up. That is my instinct with most of the cool people we expose you to here. And again, everybody, we appreciate you sending the voice messages. As you see, I loved going through them. It's 818-253-1693, and we still have more emails to go. We'll take more. It's drdrewafterdark@gmail.com. And don't forget the merchandise. I've not seen enough people with the Rational Revolution mugs. Those to me are my favorite merch item. Is it
store.ymhstudios.com.
Store.ymhstudios.com. Check it all out there. And I believe Christina will be with me next time. So check us out next time, and we will see you then. All conversations and information exchanged during participation in the Dr. Drew After Dark podcast or interaction on the drdrew.com website is intended for educational and entertainment purposes only. Do not confuse this with treatment or physician medical advice or direction per se. You must always follow your medical professional's advice and direction. Nothing on these podcasts or posted on this site supplements or supersedes the relationship and direction of your medical caretakers. Please understand, I am not playing the role of physician in this environment per se. I'm educating. I am a licensed physician with specialty boards in American Board of Internal Medicine and American Board of Addiction Medicine.